Chronic pain is commonly misunderstood, overlooked, or dismissed, yet it affects over 50 million Americans. For many of us, it shapes our daily lives, physically, emotionally, and financially. Despite how widespread it is, chronic pain remains one of the most underfunded health issues in the country. The U.S. Pain Foundation gives people like me a way to fight back by empowering individuals to participate in research, advocate for better care, and support the movement toward meaningful change. A major problem is the lack of comprehensive demographic data about who chronic pain affects. Even though the CDC conducts surveys, their current data does not cover all groups or provide consistent detail. Certain populations like active duty military, institutionalized people, and children are completely excluded from CDC pain surveys. This leaves huge gaps in understanding which communities are suffering the most. Lawmakers rely on data to determine funding and policy priorities. When the data is incomplete, chronic pain appears less urgent than it truly is. Without accurate representation, chronic pain continues to be deprioritized, underfunded, and undervalued, leaving millions without adequate care or answers. Patient-centered, comprehensive solutions already exist. They just need support. The U.S. Pain Foundation raises awareness for a full range of multidisciplinary treatments, including complementary therapies like physical rehabilitation, psychological support, and integrative approaches. These are not one-size-fits-all solutions. They are personalized, holistic, and based on real patient needs. With increased funding for pain research, we can create better diagnostics, more effective treatment options, and long-term strategies that focus on restoring quality of life rather than masking symptoms. A system that supports comprehensive pain care also reduces healthcare spending by preventing unnecessary ER visits, repeated testing, and ineffective treatments. Research participation and donations from the public help fuel these advances, bringing us closer to a future where chronic pain is understood and treated with the seriousness it deserves. Imagine what proper care could mean for people living with chronic pain. After receiving effective treatment, many could return to the workplace, regain independence, rebuild relationships, experience long-term relief, and genuinely improve their quality of life. Their overall happiness, motivation, and will to live could increase dramatically. Now imagine the opposite. Without action, research will remain limited, and chronic pain will continue affecting more and more people than the combined populations of Florida, Texas, and California. That many people would continue to suffer without answers, experiencing stigma, disbelief, and isolation. Progress will stall, but when individuals support research through donations or participation in studies, funding increases, larger studies become available, better treatment options emerge, and progress accelerates. This support improves quality of life for millions and helps dismantle the stigma surrounding chronic pain. There are 2 simple steps anyone can take to relieve the pain of millions of Americans. First, visit the U.S. Pain Foundation's website to continue to pain research through donations or participation. Second, share this information with someone you know. Awareness spreads through conversations, and every person who understands the truth about chronic pain becomes a part of the solution. By taking these steps, you help shift the system toward a compassionate and research-driven approach that allows people like me and millions of others to finally heal, feel understood, and breathe easier. As we wrap up, remember how many people are suffering and how easy it is to be part of the solution. Everyone deserves to thrive. Together, by donating and participating, we can remove barriers to create a future free from chronic pain. Now that I've shared the impact of chronic pain and how the U.S. Pain Foundation is contributing to the cause, I'd like to open the floor to questions. You can ask about anything from the research process and ways to get involved to how multidisciplinary treatments work and what the daily life is like for someone living with chronic pain.
Okay. What are some everyday challenges people with chronic pain face that others might not notice?
Having lived with chronic pain for over a decade, my greatest challenges have involved securing access to effective treatments, maintaining financial stability when the tasks that I was required of me triggered flare-ups, and even basic household chores became exercises in choosing the option that produced the least pain. Navigating complementary treatments was especially difficult due to incomplete data inconsistent evidence, and the prevalence of predatory practices targeting vulnerable patients. Ultimately, the most significant challenge was holding on to hope that my condition would ever get better.
How does incomplete data affect laws and funding for pain research?
Without concrete data, the statistics lawmakers rely on for funding and policy decisions are incomplete. That means that on paper, millions of people from these data pools are missing and essentially invisible. For these individuals to exist in the eyes of lawmakers, we need complete and verifiable studies to include all demographics. Only then can the true severity of the epidemic be recognized and properly addressed. Thank you again for your questions and for being part of the conversation. By donating or participating in research through the U.S. Pain Foundation and by sharing this information, each of us can help give pain a voice and improve the lives of millions. Together, we can make a real difference. Thank you.